and welcome to our next episode of the Hormone Café. Today, we are going to talk about supplements, and we're going to talk about supplements in the context of our women's health. So that's our vaginal health, our hormone production, and our fertility. I want to start just talking about my philosophy of supplements because I really want the core of what we do to be nutrition, because sometimes people come to me and they have this humongous handful of supplements. They're taking like 20 or 30 supplements a day because they saw it on TikTok or they read it on Instagram or they thought that it would be good for you, and they just added the next supplement and the next supplement to their list, or they went to another provider and they were put on pages and pages and pages of supplements for all these things that we're fixing. But sometimes more is not better, right? Like, we don't always want to have more of something because there's a point at which our body just cannot metabolize all those capsules, so cannot handle it anymore. So my philosophy of supplements is that we, number one, start with nutrition. So I really recommend that you undergo nutrition testing so you can see exactly what your body needs. So here we do nutrition testing, for example, to see, do you have enough antioxidants to support your egg quality? Are you making enough glutathione? Are you having enough CoQ10? Are you having enough vitamin C? Are you having enough vitamin E to support proper blood flow? And things like that. So it's really helpful to actually test your nutrients and see where you are instead of taking random and generic supplements. Another thing, for example, is we want to test your egg quality. We want to test your estrogen production. We want to test your progesterone production, your testosterone production, because you don't want to be taking a supplement that's contrary to your hormone profile. I had a patient the other day, for example, who had really, really low estrogen, and she was taking DIM. DIM is a hormone that helps you metabolize your estrogen and can actually make it lower. So she had read that DIM helps you with your hormones. However, she had a really low estrogen profile. So she was actually taking something that was really hurting her because she already had a low estrogen profile and she was taking something that can make her estrogen lower. So it's really, really important that you actually test and know what supplements you need and make sure you're getting those supplements in the proper amount for your body. So for example, if we test your antioxidants and you're really high in CoQ10, you don't need to be taking a bunch of CoQ10, but maybe you're low in glutathione and we need to be focusing on your glutathione or your precursors to glutathione. Or maybe you have really low B12, but all your other B vitamins are normal. That means we only need to be giving you B12. We do not need to be filling in a ton of B vitamins if your body already has a bunch of B vitamins. So my philosophy on supplements is number one, we need to test. So if your egg quality is amazing, you don't need to be taking 5 supplements for your egg quality. We need to be focusing on the things where we have a bottleneck or we're having problems. Or if you're estrogen dominant, you do not need to be taking supplements that improve your estrogen production because you're already making too much estrogen. We need to focus on supplements that bring your estrogen levels down and help your body metabolize estrogen. So it's really important to know what your egg quality is, what your hormone profile is, what your metabolism's doing, and what your nutritional status is, so we can literally tailor your supplements to exactly what your body needs. Another reason to measure is that we can go too high. So some supplements are water soluble, meaning that they're processed through the kidneys and we pee out any extra. Vitamin B is like that, for example. It's hard to overdose on vitamin B because if we take extra vitamin B, then our body will just pee it all off. However, there are some hormones or there are some vitamins, that are fat soluble, means that they're actually stored in our body and they take a really long time to metabolize. So the vitamins in that category are D, E, A, and K. So if we're taking vitamin D, if we're taking vitamin E, A, or K, we really need to be checking our levels because you actually do not want to be high in those vitamins. That can cause a lot of issues. So sometimes people come to me and they've been taking vitamin E for a really long period of time. And I say, why are you taking this? And they say, I don't know. I think I read somewhere that it was good. But you actually don't want to just continue taking a fat-soluble vitamin without measuring your levels. Even with vitamin D, most people tend to be low in vitamin D. So a lot of people have to take vitamin D. So we want to measure your levels, but we also want to make sure that they're not too high. Because if they're stored in our body, that's also going to affect our body's metabolic function if we have too many vitamins that we're just not able to process of. So it's really important that we're taking the correct amount of supplements, not too high, not too low. And we want to really measure those things to make sure that we're taking the right supplements for our body. For example, if we measure your omegas and your omega-3s are low and your omega-6s are high, then we need to supplement with omega-3. If we check it again and they're still low, then we need to double your omega-3 level, double your omega-3 supplement, and then check it again. And then if that still isn't working and you're going up on your supplements and it's not making your blood levels go higher, then we need to think about, okay, what is going on with your absorption? Is something going on with your gut? Is your gut microbiome off? Is your gut inflamed? Because sometimes I have patients who come to me and they say, oh my gosh, I'm taking so much NAC, which is N-acetylcysteine, or I'm taking so much glutathione. And then we check my levels and my glutathione's really low. How is that possible? Either you have a lot of antioxidant needs because your body's going through a ton of stress and you actually need way more glutathione than you think you need, or your body's just not resorbing it. So when we think about supplements, we want to think about, number one, let's measure it and see where you are and exactly what your body needs. So we're giving you the very, very minimum that you need. The most important thing is that we get it from nutrition. So if you're low on vitamin C, let's look at all the reasons in your diet where we could boost up some vitamin C. And then if we can't quite get there, then we can give vitamin C orally or do vitamin C powder or do vitamin C vitamins. But number one, you always want to do nutrition. And then number two, you want to measure and see exactly what supplements your body needs. And then if you're increasing a supplement, you want to measure it to make sure the levels are actually going up. Because if they're not going up and something isn't making sense, then we need to do a little bit deeper digging. Like, do we need to do a gut health test and optimize your gut? Making sure how you're having bowel movements every day. Making sure that the supplements are actually being metabolized and processed by your body. The other thing that I see a lot is that every supplement has some filler and some kind of a capsule. And some people just do not resorb the capsule or they have a reaction to the filler. So that's tricky because sometimes you feel like you're taking all these healthy things, but it can actually backfire on you and make you feel very unwell. So we want to really look at the fillers. Sometimes we'll do things like food sensitivity testing where we test some of those chemicals and fillers and that kind of a thing. Because, for example, I've had patients have really significant reactions to progesterone, for example. Or another common one can be N-acetylcysteine, like they take it and they just don't feel good. And then we do food sensitivity testing and chemical testing, and it turns out that they're actually really reacting to a filler or a binder or something that's used in the capsule. So it's not that you can never have that specific supplement or that specific medication. It's just that we need to be a little more diligent about looking and seeing what's in it. So sometimes, for example, people are not resorbing microcrystalline cellulose capsules or silica capsules. So then we need to look at how are we going to get that supplement in a different form. We need to have it in a different capsule, or we need to find it in a powdered version or a liquid version where your body's not going to have a reaction to it. Another thing that can be really important is it's helpful to introduce, if you have to take a supplement, it's really helpful to introduce one supplement at a time just to make sure your body doesn't have a reaction to it. Because sometimes when we're working on a lot of things, it can require that you take a few different supplements. However, if we start them all together and you have a reaction or you get a stomach ache or you don't feel well, sometimes it's hard to know which caused what. So when we're starting new supplements, it's important to start one at a time, especially if we tend to have a sensitive gut or a body who's sensitive to certain chemicals or additives or things like that. The other thing that I'll say is if your body is telling you or you're having a bad reaction and your body's telling you that it's not good for you, please, please, please do not power through. So for example, sometimes we test somebody's antioxidants and they come back low in glutathione, and then I'll have them start taking glutathione and they'll say, oh my gosh, Dr. P, I felt awful. Like I got a really bad stomach ache when I took that glutathione. If you're getting a bad stomach ache, please, please, please stop it. Like there is no powering through. When you're taking a supplement, you always want to be feeling better and better. never worse. So that means that we didn't do the right thing for your body, right? Like, why aren't you feeling good on the glutathione? Is it a filler that doesn't agree with your stomach? Is something going on with your stomach acid that we didn't anticipate? Is it a capsule that you're actually having a reaction to? So then we need to look at, okay, do we need to change the format of the glutathione? Do we need to change something differently and switch you to NAC or N-acetylcysteine, which is actually a precursor to glutathione instead? Do we need to just give you IV glutathione because your body doesn't tolerate oral glutathione? So if you're taking a supplement and you're not feeling good, please stop it, because you do not want to power through. Like, your body is your best teacher. It will tell you what it needs. If it's not feeling good on something, that is not the right thing for you, the right dose, the right capsule, the right filler, something like that. So just because the textbook says that that's what you need, we just want to make sure that we're not missing anything about your body, that we need to have it be in a different form, a different dose, something like that. There are some vitamins that we start that you have to get used to. For example, sometimes you can get a stomach ache when you take certain supplements, and then your body has to get used to them a little bit. But for the most, vitamin D can be like that. For example, sometimes when you first start vitamin D, it can give you a little bit of GI distress. But eventually, within a week or two, your body should get used to that and you should feel great. But other than that, most supplements that we take, we should be feeling great on them. So we really want to be measuring what we need. So for example, if our egg quality is low, then we can take egg quality supplements. So we really focus on our nutrition. We focus on all the things, all the ways we can get antioxidants, and then we can add in supplements from there. But again, more is not better. So we don't need to be on 10 different egg quality supplements, because that's a lot of capsules for your stomach to metabolize, especially in one day. So if we're working on egg quality, I usually recommend being on around 3 egg quality supplements. Some of the ones that I like are CoQ10. Also, it comes in a form called ubiquinol, a NAC or N-acetylcysteine. Resveratrol is a good example. Alpha lipoic acid, glutathione. So there's some really, really great egg quality supplements. But if you have a low egg quality, you don't want to be taking 10 supplements. You want to be taking 3, just enough to boost some of your antioxidants while you're boosting your nutrition and your gut health and things like that, but not enough to overwhelm your digestion or your liver or your gut when it's having to metabolize all this cellulose or all of these capsules. So another way that we use supplements is hormone production. So for example, sometimes we'll test your hormone profile and you'll be really low estrogen. So then of course we need to focus on what are the building blocks. Why are you low estrogen? Is it because we're low in omega-3s? Is it because we're low in protein? Is it because we're low in B vitamins? And while we're working on all those things, do we need to supplement that, right? Like, do we need to give you a B vitamin complex? Do we need to give you some DHEA because we need to work on your adrenal glands and their estrogen production? Do we need to be giving you Vitex or Maca? So we really want to figure out why you're low in that. What is the root cause that we're trying to work on fixing? And then what is the supplement to help us support that root cause? And then we want to measure it and make sure it's working. Because sometimes, for example, one big example is somebody has low estrogen and we start them on DHEA and we remeasure it and their estrogen is exactly the same. Well, I don't need you to be taking a supplement for months and months and months that isn't even working or doing anything to you. So we need to be taking a supplement, measuring its effectiveness. If it's meeting our goals, amazing. Great. If it's not meeting our goals, then I don't want you to be taking a supplement for no reason. So if you're taking DHEA and your estrogen's going up, great. I think that's the perfect supplement for your body. If you're taking it and your DHEA is not going up, or your estrogen production isn't going up like we want to, that's just not the right thing for your body. So we need to come off of that, go back to the drawing board and do something else. I see that a lot, for example, in probiotics. Sometimes people take a certain probiotic because they found it online or their friend was taking it, for example, and each probiotic has a certain diversity of species. So the most common probiotics, for example, are lactobacillus or bifidobacteria. So sometimes people take a probiotic and they don't really actually feel that much better, or they're actually feeling worse. And then we test their gut and then they're actually really high on lactobacillus. So then they're just continuing to grow something that they're already overgrown in. So it's super important to test and do a probiotic and do supplements that are really specific to what you need. Because maybe it's that you don't need a lactobacillus probiotic. Maybe you need a Saccharomyces boulardii or an Akkermansia or a different species specific to your gut. Or maybe you're estrogen dominant and you have a really high beta-glucuronidase and it's just recycling estrogen back into your bloodstream. Then we need to give you specific vitamins like calcium D-glucarate, for example, to help decrease those proteins in your gut that are recycling estrogen and help fix some of that estrogen dominance. So it's really important to know your hormone profile, know some of the whys and the reasons and the root causes so we can tailor your specific supplements to that specific root cause. And then we need to measure it. So another way that we need to balance our beta-glucuronidase, for example, is eating a bunch of fiber. So we want to really increase our fiber intake and then measure it again so that the goal is not to be on a gazillion supplements forever and ever and ever and always. It's that we rejuvenate our natural production, figure out some of those root causes, and then eventually come off of our supplements. So for example, if we test your antioxidants and you're really low in glutathione or you're really low in plant-based antioxidants, we look at, okay, how much plants do you need to be eating in order to bring up your glutathione levels? So maybe we need to be adding spinach to our eggs for breakfast. Maybe we need to be adding an extra vegetable to lunch. Maybe we need to be adding a little bit of a kale smoothie with a protein smoothie in the afternoon. Maybe we need to be adding a couple extra vegetables for dinner. So we increase our vegetable intake. Maybe we have to take some glutathione while we're doing that. But in a perfect world, we would actually come off of our glutathione supplement and just have everything we do be through nutrition. Or maybe we have to optimize our gut. Maybe we have a gut infection. We're not absorbing things properly. We work on our gut and then we can come off some of our supplements and just balance it through nutrition. So the whole goal of supplements is to fill in actually what your body needs, not just take supplements what your body don't need. We want to take the minimum supplements completely necessary to meet our specific goals. We want to be measuring those goals, and then eventually we want to have a plan to come off of our supplements if we can. Because I always want you to be on the lowest amount of supplements possible. So one example of that, for example, is after I do endometriosis surgery, there are a couple supplements that have been shown to decrease the regrowth of endometriosis. So omega-3 is one of those, NAC's one of those, and curcumin is one of those. So after surgery, we have a lot of inflammation. So I'll say, okay, we need to take these anti-inflammatory supplements and prevent the regrowth of endometriosis. And so we'll do that for 3 months because that is the time period where we really want to decrease inflammation the most. And then we come off of those supplements and we don't stay on them forever. Or we need to fill in with other natural sources. So curcumin, for example, is actually the spice turmeric. So sometimes instead of taking a bunch of pills of curcumin, we can do a powder and use turmeric instead. So everything that we can get from either dietary sources or alternative methods really cuts down on our supplement needs. For example, sometimes people with low egg quality, like I said, I usually try to only have you be on 3 egg quality supplements so you're not having so many supplements that were overwhelming your gut or your metabolism. But there's other ways that we can get antioxidants to improve egg quality. So if we're maxed out on spinach and we're maxed out on kale and we're maxed out on berries and all of our antioxidants, then we can look into other things like our turmeric, our green tea, to make sure that we're getting antioxidants from a bunch of different places. Or we can also give you antioxidants through an IV. For example, we can give you vitamin C, we can give you alpha-lipoic acid, we can give you glutathione, so that we're minimizing the daily supplement intake that you need and really rejuvenating you from a whole 360 picture, right? Your food, your powders, your teas, your tinctures, your IVs, so that we can really make sure we're taking the least amount of supplements necessary to meet our goals. So I always recommend doing a supplement review. So if we're working on certain goals, like we're working on your egg quality, we're working on your PMS symptoms, we're working on your blood flow to your uterus, we're working on your gut. Number one, let's measure it and see where you are. Let's measure your nutrition. Let's measure your metabolism and only give you the supplements that you need. And then in a perfect world, we work on all the root causes. We try to eventually wean you off of some of those supplements, or we keep you on only the minimum necessary. For example, if you're taking vitamin D, then we want to measure your vitamin D levels. And if you get high vitamin D and you don't need vitamin D anymore, that doesn't need to be a supplement you're taking every single day. But maybe your vitamin D goes down every winter. So every winter you go on vitamin D. So those are the kind of plans that you want to have. So you're taking the least supplements necessary, but you're taking what's needed in order to have a proper hormone balance. Another one that I see a lot is blood sugar, for example. Sometimes we start you on a supplement to help monitor your blood sugar, but I have you measure the data. So for example, I'll have you do a continuous glucose monitor and measure your blood glucose. So let's say you have a really high fasting blood sugar and your average blood sugar is in the 110s. So we start you on myo-inositol. We look at your blood sugar. If it doesn't move, then myo-inositol is just not the right thing for your body. So I don't need you to be taking a bunch of a supplement that's not working for you. So then maybe we come off myo-inositol and we do berberine instead. And if the berberine is helping you, amazing. Then you know that we have measurable data that that's actually helping your body and it's good for you, so that you know that you're not just taking a random supplement for no reason, and that supplement is actually helping your body. So we want to be measuring it. We want to make sure that the levels are legitimately going up, or our goals are being met, or our blood sugar's going down, or our estrogen's going down, or our estrogen's going up. And then if it's not working, then we go back to the drawing board and we try again. So please do a supplement audit. Come bring your supplements to me. We'll measure what you need. We'll figure out exactly what your body needs. We'll make a supplement plan tailored towards you, and we'll decide if that's something you should be on long term or if it's something that you will only need to be on short term. And then we can eventually come off of that while we work on some of those great things. Thank you so much for joining me today on this episode of the Hormone Cafe, and we'll see you on our next episode.